Hello, this is Lynn Fraser with the Kilby Center for Recovery. And I'm really happy to have Guy Macpherson here today with me from the Trauma Therapist podcast. I've watched and listened to your podcast for, I don't know, 4 or 5 years, a long time. And I've always been so impressed by the people that you have on the podcast and the kinds of topics you look at. And so the Radical Recovery Summit being something where we look at trauma as well as addiction, I thought it would be really fun to have you on here and just kind of get your perspective on things. For many years, he has done the Trauma Therapist podcast, which is seen in over 160 countries around the world. I would like to just have you start by saying how you got to where you are now. What inspired you to do that?
Yeah. First of all, thank you so much for inviting me. It's an honor to be here. Man, Lynn, when I first went to graduate school, I knew that I wanted to focus on trauma. Why I wanted to do that is another avenue we can go down. But when I got there, I knew that I wanted to do that. I knew that I wanted to work with people who'd been impacted by trauma. I felt that, whether naively or not, I felt that I could get in there and help and listen. So I went through my internships and had an amazing experience doing that, a variety of experiences doing that. And when I got out, one of the first jobs I had was at a facility in Northern California where we assessed and treated individuals who were showing early signs of psychosis. And not surprisingly, many of them had experienced trauma on varying levels and degrees and so forth. And one of our jobs each day was to take these incoming calls, right? Referral calls from teachers, parents, and therapists, seeing if their client, if their kid oftentimes was right for our program. And, we'd go through our checklist, and without a doubt, there was trauma. But what was surprising to me was that oftentimes a lot of the parents, certainly, even therapists and teachers, didn't realize that certain things could be traumatic for a kid. Bullying could be traumatic. Witnessing or listening to domestic violence could be traumatic. Oftentimes people would associate, being in a car accident or rape um, as traumatic. And I got to the point where I was like, this is crazy. Something has to be done. And that's when I started the podcast. And that was one of my main impetuses for doing that. My brother was in the special forces, and he came back from Iraq just jacked up with PTSD. And that was another one. And actually seeing what he was going through, that was another of my inspirations for doing that. So that's how this whole thing started for me.
Hmm. So, how long ago was that you were in graduate school? Because there was a completely different world in terms of trauma therapy at that time.
Yeah, that was about what, 5, 6 years ago. I had been in, yeah, and when I got out of graduate school, it was about, I think, 2 years until I started the podcast. But I was in graduate school maybe 7 years ago or something like that, 8 years ago.
And at that time, you were finding that a lot of even the clinicians weren't all that educated about trauma, or
Well,
what?
not I don't wanna generalize. There were some of them, many of them weren't. Many of them weren't. A lot of, um, uh, parents certainly weren't. A lot of teachers weren't. And in that case, we were talking to a lot of young individuals, so between the ages of 12 and 25. And in school, of course, you see the explosion, you see the acting out. And it was that got so much attention. And underneath it all, there was, again, trauma was just rampant.
Mhm.
And I just felt something needed to be done. So at this time too, I was commuting to these internships, to my job, listening to podcasts, but always thinking about my clients, like, thinking, I don't know what I'm doing. Oh, I'm not cut out for this. I can't do this. Why is no one listening to me? And I thought it would be an amazing idea if, I had a master trauma therapist right there beside me in the car who could, mentor me while I was commuting. That I was imagining that, and I wanted to provide a platform to help newer therapists who were just starting out, to get inspired, and certainly to have some knowledge, but to feel like they could do this.
Right. And so we need some understanding of how it works, but also some confidence.
That was it. That was a huge
Yeah.
part of it.
Yeah.
Even though this is what I wanted to do, I had a fear, a level of fear, a hesitancy, specifically around listening what I imagined to be, kids' stories. Like I imagine like I would be interviewing some kid or working with some kid, and they would be telling me this horrific story that would just freak me out. That really never happened. What did happen though is that I got to work with an individual who was incarcerated for many, many years, had that just awful traumatic history, and um, I really w- had the opportunity to kind of confront my fears in that way, and really learn how to be present and to sit with someone who had that kind of experience.
So what comes to mind is um, us wanting to fix somebody with that level of trauma. So what was that like for you?
Without a doubt, without a doubt. That was, when I got to school, what was on my mind was, what do I need to learn? What do I need to bring into me, books, articles, workshops, that was going to help me become the best trauma therapist I could become? I knew about, the value of presence and all that stuff, but I didn't get really um how integral and vital it was to doing this work. And, so again, naively, I was trying to just intake all this information. And it really, honestly, Lynn, it wasn't until I started doing the podcast and I started talking to these, not just initially, it was a lot of seasoned professionals,
Mhm.
but it grew to become people with lesser experience, but no less more passion. And one of the questions I would ask was if they could share an early clinical error and what they learned from that. And I was expecting, well, um, I had forgotten what was on page 22 of Bessel van der Kolk's book, and I wasn't able to integrate that, or blah 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 blah. But it was more centered around the the kind of an impasse, if you will, or uh, an inability on the part of the therapist to like be present, or to be vulnerable, or to be like there, completely there, and to be okay with that. And that was a big shift for me, and it really shifted even my focus in the podcast about the importance of uh, just being able to be with someone. And I think the reason why, because it sounds so simple, and in a
Mm.
sense it is, but it's we all know it's not easy, because you're dealing, as a therapist, you're dealing with your own stuff. You have to.
Mhm.
And so that was the big shift, a big shift for me in this whole thing.
Right. Right. And most people who go into some kind of healing work have a real desire to help. And there can be kind of a top down, I know what to do for you,
Right.
but never
Right.
work.
Right, of course. Yeah, and that's right. That was the essence of your question. But right, and certainly, when I started that, I wanted to help. I thought that with this knowledge, I could heal and fix. All coming from genuine, genuine core. But of course, and I remember one of my first experiences with my supervisor. um, I walked in there and I was very frustrated, and I was like, they're not listening to me. I had been going through, I think at the time, sensory motor psychotherapy, either level 1 or level 2. I wasn't a seasoned therapist by any stretch of the imagination, but I had some idea of what was going on. And she said to me, and I'll never forget this, and it blew me away. She said, "Why do they need to listen to you?" And I was like, "Well, what do you mean?" I had this degree and I had this, and it really sh- set things on a side for me. So yeah, that whole idea of fixing, and the therapist coming in knowing the right answer, or was another eye opening thing for me. It was one of my guests said to me way before the client walks into a therapist's room, they've been on their own healing journey, whether you realize it or not. And this idea of, the therapist or the client rather being the expert of their own experience, and uh, that whole challenge for the therapist, being able to sit with that and being okay with not knowing, being okay with not having the answer, was definitely a challenge for me, but it was very exciting also.
When you're talking about when you said they won't listen to me, and what your supervisor said, what we really need to do is listen to them. And so I wanted to kind of go into your 2.0 program where you're helping new therapists. What's your experience there? Is what do people come in really needing to kind of get?
Well, first of all, the experience there, the platform Trauma Therapist 2.0, is one of the components are these masterclass interviews that I do with seasoned trauma professionals. And those interviews are very different than the podcast. The podcast really is about me getting in there and, getting into the core of my guests and finding out how the heck they got into this incredible field. The 2.0 really is the nuts and bolts. How do you do what you do? How do you work um, in your kind of modality of choice, in a sense, whether it be through sensory motor psychotherapy or EMDR, what step by step help these newer clinicians understand that. And what I've done is collected a therapist from a variety of backgrounds. So people coming into the program get to see and hear about clinicians, from a variety of modalities. Again, whether it be, CBT or EMDR or energy work, music therapy. How are these people? And again, that's a whole other thing that just blows me away. How many different modalities there are, and ways to working with people who've been impacted by trauma. So that's what I wanted to do. I wanted to create a space to give newer therapists, or therapists who have had some experience but are just kind of beginning their trauma informed journey, in a sense, a way to um, learn about different modalities. Because let's face it, how do you decide? How do you decide? Should someone just go study EMDR because everyone's working with it, and because it's supposed to be great? Well, it might not be the best fit for you as a clinician, right? And that was another kind of eye-opening thing for me when someone said to me, "Well, part of this, a big part of this, is finding that modality that's going to speak to you, that's going to like fit in your hands magically or naturally, in a sense." So
I think it's really exciting to see, for instance, if we look at Peter Levine's work and how that has transformed over the years. And there's so many people now that are uh, trained in somatic experiencing, and there's so many other somatic methods. It seems to me that over the last 5 years in particular, there's been a lot more emphasis on we have to heal in the body, through the body, that talking and our cognitive mind can be helpful, but it's not everything. What are you seeing? What are you seeing around that?
well, I would agree. I mean, it's hard to make sweeping generalizations. And I remember when I asked, I forget who I was asking this of, and I'm always cautious when I do say, you know, try when I pose a question in terms of generality, but the question was, so do you think that it's vital that a newer clinician, someone just starting out who wants to learn about trauma and work with people who've been impacted, learn a body-based, a somatic approach? And they said yes. I mean, because of the how trauma resides in the body. Which isn't to say that talk therapy should be done away with. Of course, it has its place, but when you look at how trauma uh, sets in the body and affects the body neurobiologically, it's there, and to be able to work from a bottom up approach, somatic approach, is crucial. And in that way, one of the things that I'm trying to do is to give newer clinicians that opportunity to, again, see which modalities will work for them, but at the same time, understanding what is vitally important in this field.
Right, right. So, can you give an example of how so you've done the sensory motor training. How did that change your approach with people?
Right. Well, that's a really good question. I think what it did was, first of all, it really I slowed things down for me in a sense. When I was studying that, the level 1 and the level 2, I was I didn't I was still in school. I didn't have next to no experience working with individuals, and I was fortunate enough to be in these workshops with people who had a lot of experience. So here I was, really eager, again, like you were talking about, to help and to dispense knowledge. And what sensory motor psychotherapy, or SPI, was talking about, not unlike a lot of other different somatic modalities, was you know being able as a therapist to witness, to and at the same time be very aware, not just cognitively, but somatically, about what was going on in the moment with that client. And something could arise as a result of a query or a question. Movements could happen. Peter Levine talks about he, he was able to notice blood rushing in the jugular vein of a client when he was first starting it out, which blew me away. But that idea of being able to, we talk about being present and being aware, and it's not just of what's going on with the client, and being able to, in the moment, respond and react, but at the same time, as a clinician, you're dealing with your own stuff. So those things, both of those things, were new to me and were very challenging, because in one hand, uh, somatic therapy, sensory motor psychotherapy, is asking you to be in the moment and be creative, be able to be creative, such that you're able to uh, uh, react naturally, authentically. And that's not very easy. It's
True.
not very easy. It serves to create an environment where your client feels grounded and safe. And a lot of things happen when those two ingredients are there.
Right. And so for the clinician to be able to do that, we have to listen to our own body and be in our own body. There's a real mindfulness component to that.
Definitely. And there's that kind of work that should be ongoing, right? Either we can name the many different ways that could be uh, integrated, utilized there. But the important, and all therapists talk about the importance of self care and doing your own work. But when it comes down to it, it's not always easy.
Right.
We're all living our lives, and uh, but it's when I'm on the podcast and I'm talking to someone, and they're talking about this ability that they've honed through the years, it's very inspiring to me. There's an allowance there of letting things unfold
Mm.
that I, when I was seeing clients, I certainly didn't have. Again, I was just really eager to share everything that I was learning, you know.
Well, and a certain amount of that kind of education is really necessary, I think.
Without a doubt. Yeah. I mean, I want to say, right. I'm not saying that education is important. You have to have that, but it's understanding when to, when to bring out your attaché case of interventions. And again, it's not a binary thing. It's all integrated. Being able to utilize that, being able to. I mean, when we sit with someone uh, in a non-clinical setting, when we encounter someone who is authentic, who's just there and present, and whether they be listening to us or if they're fully engaged and they're talking about something, we are, I think, across the board, we're magnetized. We feel it. We feel that authenticity, and to be able to translate that in a sense and to be that within a clinical setting, it does take work. It requires a lot of creativity and allowance and allowing things to unfold in their own time, which, if we're starting out as a new clinician, oftentimes we're eager to get things done,
Yeah.
for a variety of reasons. And oftentimes those can work as opposites.
Yeah, yeah, people feel that pressure. So, do you, with your experience and all the people that you've worked with and talked with, do you believe that everybody can heal?
Well, I think you'd have to define heal. Does that mean that they would completely be rid of, or there would be no sign of, say, post traumatic symptoms?
Mhm.
We know. I think. What do we mean by heal? I would it, for example, if someone with complex PTSD who's experienced, severe recurring violations over the course of many years, would they be able to heal? Well, okay, what does that mean? Does that mean their symptomatology would be lower? Did that mean that they would forget everything? Probably not. So, I mean, are there ways for people to heal? Yes. Are there ways for? Does everyone have a chance to do some kind of healing? Yeah, I believe that. I believe there's hope for everybody, and I think, again, I think healing has to be uh, defined. People who've gone through horrendous experiences have, in a sense, come through the other side and been able to live, empowered lives. So I do believe in that. And I think that people have to find the right therapist for themselves, that good fit for them. And oftentimes, we find a therapist by whatever way, and it just doesn't feel right for us. I think
Right.
people have to be empowered to say, you know what, this isn't a good fit. I need to find someone for whom that fit is gonna feel right. And I think that is a very important thing to do. And I do believe that there are there's a good fit for everyone out there. There's so many different types of therapists out there.
Right. Well, and healing can look like a lot of different things, like you say. And for sure, our nervous system is not built to forget about all of the dangerous things. It's built to remember them.
Right.
We're never going to completely forget. So I noticed that you have Irene Lyon. You've interviewed her in one of your master classes. So she really talks a lot about the nervous system and how to heal the nervous system. Is that something that you feel is important in trauma therapy, just on its own, healing the nervous system, calming, down regulating?
Yeah. I mean, well, I think it's vital. I think it goes, part and parcel with working with the body and healing trauma. I mean, that's one of the important things. I think that uh, you know when you look at talk therapy and you look at the importance of talk therapy, but you also look at how trauma impacts the body, impacts the nervous system, distorts the nervous system, and then resides in the nervous system. In order to heal that, one has to obviously understand about what's gone on in the nervous system and understand how to heal the nervous system. So yeah, I think that's kind of that crucial component of working somatically,
Right. As
without a doubt. I mean, without a doubt.
then as people feel safe with whoever they're working with, then our nervous system can relax, and might be the only time we've ever really co-regulated with somebody and felt
Right.
safe to.
Right. That whole idea of co-regulation and what's involved with co-regulation to me is another, I think, magical things that happens when it's the power of, you know, being able to sit there with someone and not judge and have it be okay, have it be okay for you as a therapist about whatever's happening, without having an agenda. When I was first starting out, I had an agenda. My agenda was to basically, I wanted to help, but also wanted to show that I knew about trauma and how to heal. And of course, it sounds ridiculous just to say this out loud, but that's where I was at when I first started, you
Yeah,
know. But to see on a day-to-day basis, Lynn, and to hear about clinicians who are through their experience are okay with, you know and understand the power of what's involved with co-regulation. That to me is inspiring, because it speaks to, I think, the importance of us as humans, and we need that to be seen like that.
right. One of the things that I really appreciated when I learned more about ACEs and the adverse childhood experiences is that neglect and not being attuned to, not being seen or known is very traumatizing for children, and
Right.
helped me to make sense of a lot of my experiences as a teenager in particular. And so I think that kind of knowing that is really helpful. It didn't seem to be in anybody's awareness until, the last maybe 5 or 10 years, how
Right.
important that is, that we need to be touched and held, and we can have, trauma just from being emotionally neglected, let alone physically abused or neglected.
Yeah, yeah, yeah. This idea of not being seen on an emotional level, certainly,
Mhm.
on a somatic level, certainly is very powerful. Doing this, I'm just kind of immediately taken to thinking about how learning about these things and doing these interviews really has impacted me as a father. It's very easy to uh, address, again, the kind of behavior, the explosive behavior or outbursts of behavior or addictive behavior, and not see or not look for or not understand what's going on below that. What is causing that, in a sense? What's compelling that type of behavior, in a sense? Um, and my feeling is that, in part, a lot of times we people don't want to see that because it's difficult to see, it hurts to see, it triggers our own, certain memories and behaviors and so forth. Um, but that's where the work is done, really.
Yeah, one of the things that I've appreciated about Gabor Mate's discussions around this is that, oftentimes parents really fail their children. And, when I look back, I was a mother at 20 and a single mother for many years, and then in a step parenting situation. My son was abused by a step parent, and I didn't see it. I didn't see it because of my own trauma. And there's all kinds of reasons why people are in relationships that they are. And that was such a difficult, that is the most difficult thing that I've ever had to work with, is to not shame myself for not being more healed at the
Right,
time. And
right,
so Gabor talks about, that we're not looking to blame the parents, but we are looking to be clear and acknowledge the truth. And that from there, maybe we can do some healing. And then certainly that's happened with my son and I, but it's been based on the truth of that was wrong what happened. And I wish it had been different very badly. You know?
right. I mean, yeah, I think that's a good distinction you made about not blaming, but also, being able to look at and see the truth. That's very similar to what we were encountering when I was working at the job and we were in the early psychosis clinic, because these issues we're talking about, they just don't arise out of nowhere.
Right.
Trauma just doesn't happen.
Yeah.
It happens because of certain things that happen. And oftentimes those things are caused by people. And oftentimes, when we were working with these young kids, the parents were involved or not involved. And it was very easy to blame the parents. And in reality, a lot of times it was the parents' fault. But, what you're bringing up here is, again, I think a healthy distinction, not just in a realistic sense, but for moving forward in terms of treatment. Shame is extremely debilitating, and blame is extremely debilitating. But, you know, again, looking at why something or how something happened realistically, being able to name that is very important too.
So if we segue into the world as it is right now,
Oh, you're going to do that.
I can't help it. Last night was in elections. We're recording this November 4th. What's your take on the relationship with trauma and how trauma and fear are working in the world as we know it
Mm,
right now?
yeah, that's a good question. It's a loaded question, and I think it's 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 like the button, the trauma switch is on. And I think it's almost like that analogy where you're like cooking a lobster and it doesn't even realize it's in the heat until it's too late. This is a collective trauma. I think it was Janina Fisher who I was interviewing. I did this series on managing in the midst of the pandemic. And she said, this is an ongoing trauma that we're going with, that we're experiencing. And trauma cannot be healed when it's going on. It can only
Uh,
be healed if it's past. And I think we are all collectively being traumatized. And you can argue whether it's subtle or virulent or what. And obviously, I think we're all feeling it and processing it different ways, but it's real. I think collectively it is real. When this whole thing started with the pandemic back in March, I was so anxious. I was suddenly home with young kids. My wife fortunately was able to work, but out working, and I was really anxious about what was going on. And oh my God, we're all going to get sick. And I was checking the news, and I was going nuts, Lynn. And I was like, I can't do this. I need to stop. What I did is I just shut off everything. I stopped, checking checking the news all the time, and it really, really helped me. So I was really thankful for that. Yeah, it's a really good question, and I think we have to be aware that it is happening and occurring.
right. Yeah. And not be in denial about how hard it is.
And not be in denial about how hard it is. Yeah, because of course, and then you throw in the election. I mean, well, the pandemic is global, right? The election, of course, is national only, but it's this kind of 1-2 punch in a sense that nationally we've been dealing with for a while, right? Um, and it's whatever side you're on, it's it's hard, it's traumatic, man.
Yeah. People feel misunderstood, not respected, threatened. Yeah, there's a lot of high emotions. And I'm in Canada, I'm a Canadian, but we still feel very much the effect of what happens in the US. And, it's not just the reach of the US around the world, but it's like driving by an accident and not being able to take your eyes off of it.
Right,
It's
right,
really
right,
hard to watch, but we
right.
don't
Driving.
know.
That's a good analogy. Yeah, it's the flip side of that, though. I mean, if we're just talking about the pandemic. There's a sense, a shared experience, which
Mhm.
can have some comfort to it too. We're all in this together. And then you look at, well, what are the positives that are coming from this?
Mhm.
And I think there are some that are coming from this, but nevertheless, you balance it out with how many people are getting sick, and then crazy numbers that we're experiencing about people getting infected and dying, of course. And it is frightening. It is scary. Yeah, that was a good question.
Yeah, it's a hard time. I think that we have this idea in the 87 to 94, I worked in an AIDS organization, and I really saw how people felt ripped off that they didn't get what they thought their life was going to be like.
Mm,
So, at the time it was mostly young gay men, in their 20s, sometimes 30s. And it was like, I'm not going to get the 80 years of good health and happiness and then die in my sleep. I'm not going to get that. And I think that we have that. It's very sticky that we have a hard time realizing that life is hard. Life
mhm.
isn't easy for anybody in any time, let alone during a pandemic with all the racial unrest and all of the election stuff. Life is really difficult. And so not everybody has had high levels of trauma, but everybody's had kind of the trauma of ordinary life. And now we're having this shared global pandemic as well. And so I think
Yeah,
one of the things for me that's really been helpful is just all of the new awareness around trauma and how to help with the nervous system and how to connect with each other.
mhm. Yeah, that phrase "high level of trauma" made me think about, it's easy, I think, to judge oneself against someone else
Mhm.
who's maybe experienced a high level of trauma. And I think one of the important things to realize is that, and I think really for the people watching this, is that what really matters is really how you feel and how your body has interpreted the trauma. It doesn't matter you've experienced. It doesn't matter if it's been a level 10. It doesn't matter if you've been to war, combat, or have been sexually assaulted. What matters is where you're at and how you're experiencing where you're at. I was someone who was bullied when I was young. And Lynn, that just jacked me up. It really impacted the trajectory of my life, my self confidence, how I showed up in relationships, um, how I showed up academically, and so forth. And you could argue, well, and a lot of people would, well, that was just bullying. Kids are like that. You didn't go to war, you weren't in an accident, whatever. So I think it's important for people to hear that, it doesn't matter what you can't kind of judge yourself against someone else's experience. What you've experienced is valuable and meaningful to you, and how you move through that is the question, and your own journey.
Right. And one of the things that is becoming so much better known now is the value of connection and attachment. And so somebody might go through something really big T trauma, but have a really supportive home life or parents or not feel judged and shamed. And then there's others of us who it never would have occurred to me to tell my parents what was going on. So I knew that that would not be well received. I'd be blamed for it. So that kind of an experience, and people can often kind of recreate maybe or create for the first time with a trauma therapist, that feeling of really being able to say exactly what's going on and not be judged. That's just so precious and so
Yeah,
essential.
you're right. Yeah, I'd agree. I mean, it's huge. Understanding, and this is where just providing psychoeducation is so valuable for people to understand that there are certain buffers and resources that are out there that they could learn about that
Mhm.
can help them now and in the future. Certainly, surrounding oneself with loving and understanding and non-judgmental individuals goes a long way towards the healing process.
Does. Yeah, that's for sure. So let's get into addiction. Do you have anything that you'd like to kind of any people you've worked with or insights you have? How does trauma relate to addiction?
Well, yeah, I mean, you brought up Gabor Maté, and I think I don't want to say famously known for saying this, but he has said in the past that when you have addiction, you have trauma. They oftentimes, if not all the time, go hand in hand. And I think it's very easy for people on the outside looking into someone who is addicted to look at that behavior and make a lot of judgments about it without realizing, again, we've talked about the underlying uh, soil, if you will, foundation, what's going on beneath these behaviors. Um, and oftentimes there is trauma there of varying kinds. I think that's crucial. And I think oftentimes people become addicted and they don't recognize that they have been traumatized, right? They haven't been to war, they haven't been to an accident. They don't understand that they weren't brought up in an environment of attachment or attunement. That doesn't, they don't recognize that. And I think things begin to unfold such that maybe they get into a relationships and there aren't the formative pieces of the puzzle there to help them deal with certain things,
Mm.
and they start utilizing get involved with certain behaviors that help. Right? Oftentimes, people who become addicted use certain substances because they work.
We wouldn't do it if it didn't work.
Right.
So when you're working with addiction, so were you working with that like when you were talking about your early years with the psychosis? Was addiction part of that as well?
No, addiction wasn't so much a part of that. I my experience was in a clinic in San Francisco. I was working in a substance abuse clinic there.
Mm.
We were working a lot with addiction, but it wasn't so much with the early psychosis
Okay.
population. Actually, I don't know if that's true. I mean, it kind of looked a lot different. There was a lot, there was a lot of cutting and so forth there. First of all, for someone who is addicted, understanding more likely than not, there has been some trauma going on there. And how is trauma defined? And the many things that can be traumatizing and how those things can be traumatizing. That can be very eye opening for an individual.
Right. So if you were working with somebody who's just kind of on this near the beginning of the journey of recovery, like one of the things you said a little while ago was everybody has already been on a journey of healing before they ever get to you. And that's really important to acknowledge too. So what are some of the things that you might say to someone, whether it's around addiction or just, someone who's coming in with trauma? What are some of the most helpful things to know about as you start this journey?
I think one of the most important stances um, would be one of non judgmentalness, being able to be accepting,
Mm.
certainly on the part of a therapist or clinician or whoever is on that is working in that sense. Because oftentimes there's a lot of shame, a lot of denial going on the part of someone who is addicted. This feeling of helplessness. I mean, kind of everything we've been talking about up to this point really, I think, pertains. But being able to, again, being able to create an environment where it's okay where one is at the present, and to understand, and of course, you know, if someone is in dire need of if there's an emergency going on or there's a health emergency going on, but and of course, if someone's addicted, that probably could very easily be the case. But I guess what I'm just saying here is, the importance of creating an atmosphere of hope, of understanding, of being willing to at once understand that the behaviors that are going on are working. Probably they're working very well, but in the short term. but we all know where that most often ends up in the long term. But at the same time, understanding that there's a reason for that behavior. And I think I really believe that of course, there is a reason for that.
Mhm. Yeah, for sure. And when you were interviewing people about COVID and near the beginning of the pandemic in particular, so we're seeing now certainly higher rates of addiction, collective trauma. What I'm seeing is a lot of people are going back to old habits, maybe that they aren't so familiar with anymore. It's something in the past. But now with this higher level of anxiety and trying to cope, that we're kind of going back to some of the things that worked for us in the past, which makes sense.
Right.
But some people are talking about too, let's not shame ourselves for whatever it is we're doing to make it through this time. So I'm thinking about
Hmm.
that, what you said about we can't heal the trauma while we're going through it. What we can do now is just kind of manage it.
Right. Yeah. And that's a tough one. I mean, it's one thing to be traumatized, have been traumatized, and have it be in the past and be able to look back at that. It's another thing to be in the moment and realize that we are living through something that is traumatic. Again, we're all going to be experiencing it at different levels and in different degrees and so forth.
Mhm.
Um, and for some, let's face it, people, not everyone's going to be traumatized by this, but at the same time, what things can you do to help in a sense? And
Yeah.
that, I think, we each have to take a look. Bruce Perry, he said it's important for everyone to be. This was right when everything started, pretty much, and that tagline had come out and through the government. I think it had something to do about maintaining distance. But
Well,
he said, it's important to be emotionally close while we're physically distant. And that's crucial to be able to maintain emotional closeness. And what is that going to look for you? What's that going to look for me? And to be able to do that, we just moved from Oakland to Bend, Oregon, right a couple months after everything hit. And my wife said to me the other day, she said, what are you going to, how are you going to integrate during this time?
right.
It's one thing to move to a new town and to, be able to interact with other people. But given this pandemic, things have
Mhm.
become, exponentially more challenging.
Right.
So,
Mhm.
I think the question is, what can you do to create a support system, to stay healthy? All these things that we all talk about all the time, but they're crucial right now, if not more so.
They really are. Well, it looks like we're getting towards the end of our time. Thank you so much for being here. I really honor your perspective and, the experience that you bring. So how can people get a hold of you?
Yeah, the best way would just be go to the trauma therapist project, traumatherapistproject.com, and people can, access the podcast there, or Trauma Therapist 2.0 there if you're a new clinician, or just email me. Uh, I'm there. I'm on Facebook, and I'm happy to engage with people. But also, Lynn, thank you so much for inviting me. It's an honor to talk with you, and it's great seeing you again. I really admire what you're doing through this
Awesome.
platform.
Thank you. I admire what you're doing too. So thank you.
Welcome to the 2021 Radical Recovery Summit, presented by the Kilby Center for Recovery. This is Lynn Fraser, your moderator. This year, our theme is Feel It, Heal It, a new paradigm of recovery, featuring a diverse group of thought leaders and innovators, people who are working on the ground in the new field of addiction recovery. Go to radicalrecoverysummit.com to sign up and watch free.